You are watching the DocTalk show.
Parents will walk in with their children, most likely to a pediatrician, with complaints that are usually, my child cannot speak, my child cannot do this, my child behaves in a way that I don't understand. And most of the time upon assessment, the doctor will tell you, your child has autism. But Dr. Justin, how do you go down to tell that, actually to confirm that this child has autism?
We have discussed previously. We want to make an assessment of this child. We want to know how they are presenting. We want to know all the symptoms, maybe if they have any difficulties in social interaction that we went through, then maybe the language development. We want to look at other social skills, if they've been attending like toilet training, tend to have feeding problems. You have to make all that assessment. You have to look at maybe the self-injurious behavior, if they are any. All that encompasses different management. So you have to do this child assessment very well. Think about maybe taking history from the mother, also the things of development and any maybe genetic history is very, very important.
Simply say that, this, for example, in medical school, we are taught that history taking and examination takes 80% of the diagnosis. But this is an ailment or a problem whereby it will take 100%.
Actually, in psychiatry, it's mainly around 80% of our diagnosis is made through history taking. Because
like any other disease, but this one particularly, autism. Do you have any labs?
If the child has autism?
I don't think so.
Not really.
Yeah, so meaning like 100% of the diagnosis
it's
will be,
clinical,
many times it's clinical,
yes.
History taking, and maybe proper examination of the child.
Then also as well, to look at that individual child needs, because all of them want to present the same way. You know, that person can find, okay, maybe in this child, what is the problem? Is it the behavior problem that is coming in? What are they doing? You want to know maybe in our treatment, you analyze the behavior. Maybe if there's short tantrums, maybe when they're told to do an activity, you want to find out what happens before this behavior comes in. What are the antecedents of this behavior? What are the consequences, the outcome? What does the parent do? We want to begin from that. Do they maybe slap the child? Do they beat the child?
So maybe bring it out.
Analyze the behavior of that child that is presenting to you.
So I mean, you have to be very careful not to mistake some babies who are or kids who are abused, like child abuse.
That's actually our differential.
Yeah,
our differential.
Meaning you might think that the child is maybe withdrawn, they don't want to interact, but because they are fearful. So I think we have to analyze the environment back home. Exactly. What is happening at home? Because you might miss a diagnosis and you think it's autistic, but because someone is abusing this child.
Actually, that is the reason why when a child comes into assessment, we want to look at the child themselves, the genetics, then the temperament. Look at the family, the parents, how they interact with this child. Look at the school environment. Is it all the same setting? Is it occurring in every setting, either at school, at home, and everything? So you have to all go into that. Then usually when we're trying to deal with autism, we don't going to maybe treat all the problems at the same time. Want to maybe try to ask the parent, what is more challenging for now?
Yes.
But before you even go to treat, you said majority of the diagnosis is history. So clearly you need to take the history from the parents. Sometimes you might find that one of the parents is autistic, or in their lineage, one of them was autistic. So it increases. But the most important history is on the patient themselves.
Exactly.
And does this worsen the situation? Because sometimes for most parents who are not aware about autism, you might find that they worsen the situation. When a child behaves abnormally, the child will be beaten.
Maybe I want you to raise it. There could be special clinics for this type of children, because I'm seeing the way you're bringing it up. Many times maybe we have missed, me inclusive, or we the typical clinicians with the workload we have, even the pediatricians per se, that we have missed this diagnosis. That do we need maybe to encourage the clinicians who see these babies, if they suspect such symptoms, to refer them to special clinics to be given attention, because you could see that history taking and the details of the history has to be real. So should be people really that have dedicated most of their time into it.
Because Dr. Justin, yes, you're a psychiatrist. People know psychiatrists deal with people with sick heads. You get there, you're given a jab, you sleep. You're violent, you're given a jab, you sleep. So someone really would want to know, do I have to take my child to a psychiatrist? Is there a special group of...
The stigma surrounding psychiatry, they will think that when you go to, maybe refer you to Butabika, you are mad.
What do you do with these children, Dr. Justin, when they come to you?
Majority of them actually they are referrals. Maybe the pediatrician identifies some maybe behavior changes. Maybe they are referred to the psychiatric unit. Like I've told you, you have to just do an assessment and you find out what are this child's needs. If the problem is speech, maybe you have to refer them to a speech therapist. Yeah. Then if they have maybe behavioral challenges, self-injurious behavior, they are throwing tantrums, you have to deal with the behavior.
So it's a multidisciplinary management.
Parents out there, the future is really, really bright because people are in the labs, they're trying to find out what could be the cure for this ailment. Because recently, the stem cell technologies on whereby they can replace all the bone marrow, so that you could have maybe actually you could cure this disease, like any other genetic problem, like in sickle cells. I think the future is really. The only problem is that it is it's very expensive and really not accessible to us. But at least you don't know where we are going. Yeah.
Aside from stem cell treatment, it's also important, just like we noticed that there could be maternal factors. It's important to stress that people take their prenatal vitamins, then you handle their pregnancies, you deliver them in the safest way possible, give children probiotics. But again, for the parent who is out there, where, without stigmatizing my child, where can I seek attention?
These are now available in all the regional hospitals. At least now we have a psychiatric clinical officers. They know how to identify these problems. Yeah. Even in Mulago Hospital, we have a clinic which runs on Mondays, and then the Talca Hospital. You know, so there are some NGOs that are trying to help these children with autism. Yeah, that are available.
So in other words, when you have a child like this, you shouldn't seek care from the traditionists. Shouldn't be on your pastors. Of course, prayer is okay.
Prayer is fine
for total care, and but at least there shouldn't be
at least they were not bewitched.
You're not bewitched.
You're not bewitched.
So the services are with us. You can access these services.
And early intervention is very, very important.
So for our parents, the caregivers, and everyone else there who is handling children, look out for these symptoms that have been elaborated in the show. If you think a child needs medical care, kindly take the child to a qualified health practitioner so that they can be assessed, and surely they will be treated in the right way. Thank you very much, Dr. Justin, for sharing with us these extensive thoughts about autism. I'm sure our parents out there, caregivers out there, have benefited a lot from this rather seemingly mysterious condition. Thank you very much, Dr. Billy, and me myself, Dr. Nyombi. Our viewers, don't forget to follow us on Facebook, The DocTalk Show, on Twitter, our Twitter handle, The DocTalk. Send your comments and questions. Until next time, it's The DocTalk Show.